Nico,
Miguel,
so we're finally doing it.
we are.
I think it's about time.
Definitely.
And we've been going back and forth for years now, every day, through in-person video calls, text messages, talking about the things we're interested in, health and longevity. And I think it's about time that we share our conversations with the public.
Yeah, 100% agree.
Maybe you want to share, so that the viewers also get to know you a little bit, what got you first interested in this whole topic?
For sure. So I've been interested for the past 10 years into this health optimization longevity topic. Mainly started because I was feeling pretty uncomfortable with my own body, was pretty underweight. I'm super tall and then I was, as I said, pretty underweight. So I really wanted to change that. This got me hooked into the gym, nutrition, all of that stuff. Read a ton of books, listened to a ton of podcasts, and this really got me hooked to this whole health optimization topic.
Interesting. So certainly some sort of own personal health story in there.
Yeah, definitely.
And lots of learning over the years.
Oh, tons of learnings. Yeah, definitely.
Interesting.
Yeah.
Yeah, I can certainly relate to the own health issue topic. This is what got me first interested into all of it.
Yeah.
Being kind of failed by a system, having to deal with illness and not receiving the help you would want to receive, and then kind of having to figure out the things on your own. Yeah. Sometimes there's also lots of learning and value through suffering if you're forced to get out of a situation you don't want to be in. So I can certainly relate to that. And I also think it's interesting because for me, it was mostly about getting from sick to some sort of healthy. But then you start to understand that health is really a spectrum where you have from severe chronic disease to kind of healthy to optimal health. And I feel like most of the conversation around the topic of longevity, which we will certainly delve deeper into, is really about optimal health. Because if you're optimally healthy today, then the logical consequence would be for you to live for a pretty long time as healthy as possible. So I think that it's mostly also about optimization, which we will delve a whole lot deeper into that.
Yeah, certainly agree. Yeah.
So Nico, maybe you want to share a bit about what exactly we're doing here and why.
Yeah, definitely. Happy to do that. So the intention behind our podcast, Return on Health, really is to bring everybody on here, to bring evidence-based people on here, to also bring people out here who have a controversial opinion, maybe do not have any data to back them up. But this may still be interesting or may pan out in the future to be super, super interesting for human health optimization. We don't know yet. And what we really want to do is we want to challenge these opinions. We really want to challenge their thinking and really get deep into their thoughts. That's really the mission behind Return on Health. But what really is Return on Health about?
Yeah, I think it's great what you're mentioning, and also maybe for the people to understand why we called this podcast Return on Health and what our take on all of this is that obviously we both have a business background. We got to meet each other 2 years ago or more than 2 years ago during our masters at a business school in Lisbon at NOVA. And of course, everyone talks a lot about return on investment a lot. And of course, this is an important metric, but it's certainly not the only metric that should matter. And we think that the benefits of having good health extend far beyond just the monetary value of it, which is why we decided to call it Return on Health. Because also what you can see in our logo is that we think that regardless what you do in your private or professional life and all the inputs you have before, you could kind of see it like a large language model. You have so many nodes and so many interesting and important things before that, whether it be work, education, whether it be family, friends, social life. And all of these things are very important, but at the very end, before you can actually realize any of these potential gains, it flows into that last node, which is the health node. And if that node is positive, if health is given or even optimal, then we believe that return on health is infinite. There's no limit to it. But if everything you've done before is great or has great potential, but that last factor, health, is not given because you're dealing with sickness, then regardless of what you've done prior to this, you will not have a good outcome. And so we really want to reframe the whole debate and put health at the center of it, because it's the one thing that matters the most, because if absent, all the other things you've done, they don't matter really anymore.
Yeah, sounds like a great concept.
I think so too, and I'm very excited for us to share this with our audience, to bring all the private conversations to the public, and inviting some very interesting guests.
Yeah, certainly agree. Think it's a great project.
I think so too. I'm really looking forward. So what exactly can our viewers expect in terms of topics in this podcast?
Yeah, we will bring on a bunch of different people. We will bring on people from politics, from medicine, from business. We will talk to everyone. And in terms of topics, we will dive into pretty much every topic which is out there. For example, nutrition. We will talk about our water, which we drink every day. We will talk about toxins. We will talk about sports, gym, cardiovascular activity, and prevention, for example. And then also maybe more advanced stuff in longevity.
So we will certainly also dive a bit deeper into all of these very fringe, advanced biohacking, cutting-edge treatments, who may also be on the front news of certain magazines because they draw so much attention because of their controversy. Yeah. And that's exactly our point, right? We want to give people the best possible information for them to achieve health on an everyday basis, with regards to their own choices and the simple choices, but we will also want to look at the more advanced things that are out there, maybe promising, maybe dangerous. We'll see.
Definitely. And that's also the thing with the podcast. So me, myself, I'm on the evidence-based side. I mainly look at data, all of that. I also have a data background, which makes sense then. And Miguel is always deep into the weeds. He always talks about like the newest scientific stuff, for example, which I never heard about. We also have conversations about stuff. He's sending me WhatsApp, for example, with stuff I literally never heard about. And I have quite a good knowledge, I would say, in terms of health optimization, longevity, all of that. But he always finds the newest shit out there, pretty much.
I think that's also what makes it very interesting, that we both have such a deep interest and passion for these topics, but we do have some sort of interesting different lens of looking at this whole topic, right? You're taking more the evidence-based approach. I also like to look at the more extreme things of personal experimentation that are out there, and we believe what we try to do from different perspectives is trying to get to the truth, right? And so I think this is what really unites us in this mission, and where we think it's so interesting to bring in different perspectives together, so that ultimately we can all make better decisions and live a healthier, longer life, and also enjoy life more, because that's really what it's mostly about, right? Many people then think that they need to get stuck up in their health routines and their 3-hour morning routines. We would never advise anyone to do that, right? We would say to people to like try to make the changes that actually add to your quality of life and not take away from it, right? And we believe that that's possible through knowledge.
Yeah, 100%. I mean, community is such an important factor, and we will 100% dive deeper into these topics later on. But as you said, it's all about fun. It's all about enjoying life. That's the most important thing. You as the viewers, you most definitely spend time on social media. I think we all are. And if you spend time on social media, you probably saw people getting a raw vegan diet and telling you that the raw vegan lifestyle, raw vegan nutrition is the way to go. On the other hand, there are also people saying to you, okay, you need to eat only meat. That's it. You only need to eat meat. Then there are also people eating a quote-unquote animal-based diet. So meat, honey, fruits and all of that. That's really, really confusing. Raw dairy as well. That's crazy, by the way, but in my opinion, at least. Maybe Miguel thinks differently.
We'll dive deep into that.
We'll definitely are, 100%. But I think it's so confusing out there. There's so much misinformation, so many people cherry-picking studies just because they are on their own bias. They really want to prove their point and all of that. So that's super confusing. So what are we going to do about this?
I totally agree. And literally last night I was at dinner, and that was the one thing people were most concerned about, this whole movement, because obviously longevity is a hype, but then there are so many people trying to position themselves in a field. And obviously in social media, or on social media, there's the more extreme your opinion, the more it gets pushed out by algorithms. And so people are incentivized to oversell their opinions and make them make bolder claims that are maybe not even true at all, but just they know it will sell better. And this is exactly what we understand and what we want to be the antidotes to, because we know what it's like for people to not be at the at the health state they would want to be in if they are dealing with an issue, from minor to severe. And what we want to do is we want to do the hard work. We want to talk to all the experts. We want to extract these information and hand it out to people so that they can make actionable, good choices in their lives, so that they can, regardless of where they currently are on the health spectrum, that they can move more towards optimal health and enjoy life more. That's really what it's ultimately about and why we're doing what we're doing.
So we've been both through different health struggles on our own. Like for me, for example, during my time at UC Berkeley abroad in the US, I had like severe dizziness and thought I was blacking out all of the time and was feeling really uncomfortable, really anxious. And I was like, okay, what the fuck is going on? Then like one time I went to the gym, which I went to like 5 or 6 times a week, like did all of this stuff, ate healthy, all of this. And then went to the gym and just suddenly had a heart rate of 160 without even doing exercise, was feeling extremely dizzy, was feeling like I'm having a heart attack. And I was like, okay, what the fuck is going on here? Then, as I said, because I was feeling like I'm having a heart attack, really felt like it, couldn't breathe, all of this stuff, went to the emergency room and then, yeah, went through different testing like chest CT scan, X-ray, different blood testing, all of this stuff. And in the end, they said, okay, you are fine, like physically. And I'm like, pretty sure I'm not fine.
Yeah.
But okay, then I'm leaving, I guess, because they just sent me home. Then they told me to speak to a cardiologist, which I did. And he said, I'm fine. And I said, okay, great, but what is going on? Like, what's happening right now? Then I went to my GP back in Germany. And she actually asked me a question like, okay, physically you seem fine. We did all of the labs, we did all of the testing, but what about mentally? And that was like, okay, yeah, that definitely could be the case. Like it was so much stress going on when I was abroad. I mostly never take any breaks and all of this. I went to the gym 6 times a week, which is great generally. But if you already have a high stress level, then maybe
Classic
it's
high
not
achiever.
so great. Yeah, classic high achiever.
Yeah.
That's a huge problem with myself. And then she went to ask me, okay, you should see a psychologist. And I was like, ooh, okay, psychologist. This sounds weird. Maybe I don't know if I really want to go, but I went. And then, I got a diagnosis, panic disorder. So it really whacked my nervous system pretty much, which was insane. But this really just shows like how the system works. It really just doesn't see the body as a whole. And only, like, for example, the cardiologist says, okay, the heart is fine. The emergency room says, okay, you don't have a heart attack. But nobody is really like pointing you towards a different direction. They just say, okay, for my specialty, this is fine. Which is a problem in my opinion, yeah.
I agree. Too much fragmentation can lead to high specialization within that one field, but then again, you might completely lose track of the body as a whole and the interconnectedness of all of these systems. And I can certainly relate to the health story. Maybe a little bit of a different one, but I certainly know what it's like to have an issue and try to get to the bottom of it, and consulting many experts nationally, internationally, trying to really get to the bottom of it and trying to get better. Like everything that I've been doing, everything like how I got into all of this space was literally just me trying to solve my own issues and learning things along the lines, right? Because then if you have a hypothesis and you test for it and then it didn't turn out to be that thing, then at least you learn something about that hypothesis and pathway and possibility. So there's lots of knowledge that came through it, but like what I want people to know is that we know what it's like to go through severe suffering, but we also think that it's empowering to know more, to have more knowledge and information so that you can make the right choices even if you're stuck in a very bad situation. And we know what it's like for situations, health crisis, to put a pause on your life. Like I had to postpone a whole master's degrees because of hospital stays and so on and so forth. So that's why I want people to understand that this whole return on health thing is a deeply personal one to us, because yes, we've been talking about the gym, we've been talking about the diet, and we've been talking about all of the goals you have for yourself and your career. But if that one thing, your health, breaks for whatever reason, then all of the other things, they really don't matter anymore when you're there lying in a hospital bed and praying for results to be okay. So I want people to take away that we understand them and we want to try to empower them as much as we can on their own health journey to live life to the fullest. And yeah, I think it's through the years we've made some interesting experiences ourselves, met some interesting people, and we want to bring them along so that we do exactly the opposite of what you've been describing, of like the fragmentation in the system, so that we bring it all together and hear all the voices and try to get to the bottom of things.
Yeah, that's the goal. Yeah.
Niko, why should people listen to us talking about these topics?
I mean, that's a great question. Like, first of all, because we went through the struggles, we really know what it feels like to have health struggles, to not feel optimally healthy, which is already a great factor. Then, like in terms of our background, my background, for example, I've been in this space for 10 years. I've been a licensed personal trainer. I've looked at all of the nutrition books out there, studied at UC Berkeley, for example, where I also took courses in neuroscience, for example, which were super interesting. Maybe we can talk about this later. Then, as of right now, I'm working in Germany's leading longevity clinic, which is super interesting. Help building this, help really decode aging, go through the ground of the data. And then also, right now, I'm doing the first master in longevity at Geneva College of Longevity Sciences, which is also super interesting to really dive deeper into the science aspects of longevity. How about you?
Yeah, I think it's, as you mentioned in the beginning, the first and most important thing is that we are deeply curious about all of it because of our own stories, but also because I think we might have an interesting angle, because I always say that I'm a business guy on paper, but a medicine guy at heart. Because I also have a business background. We met at a master's at NOVA. I did another master's where I also studied at LSE. Did some internships in the corporate world, so we know that lens. But also, I think we can see we can take a look at this topic through different lenses. So we know the corporate side, we know the business world, we know what universities teach and what sort of the general notion of looking at these things are, but also we made other experiences. Like I've also been working at the longevity clinic where we are working together. I've been deeply involved in social media projects with doctors and neuroscientists. And I've also seen the other side, like the real academic side, because I've been part of the Health Longevity Talent Incubator at NUS in Singapore last year as a participant, where I was one of 40 selected participants from master's levels to PhD and MDs. Which was so interesting because it was like, now I was in an academic setting, but in an academic setting that I actually really intrinsically liked, about healthy aging and stuff. And then this year I returned to the Healthy Longevity Talent Incubator now as a mentor, leading some of the research there. So I think we can draw from many different perspectives, and this is what we want to show people.
Definitely.
That's it for the first episode. Thank you very much for listening. I'm really looking forward to everything that's yet to come, because ultimately we're doing it for you. We want you to have a better outcome. We want you to have more fulfilling life, higher quality of life, and enjoy life more, resulting from better health. And we are really excited to bring on the best experts to help you along this journey. And that's it. Thank you, Niko. Thank you to you listening, and looking forward to seeing you soon.
It's going to be great.